Hi everyone, this is Sean with the Western Mass team of the MassSupport Network, here with your COVID-19 update for Friday, September 18th, 2020. So, cases have passed 30 million worldwide. Here in the US, we've topped 6.6, 6.7 million, and Massachusetts at 126,000. Increases, that's over 2 million new cases in the last week worldwide, which is a significant increase. It's the first time we've passed 2 million cases in a week. In the US, things are up slightly, and we'll talk about that in a moment. About 280,000 cases there. Massachusetts, things are holding more or less even, a little more than 2,000 cases a week. In terms of deaths, worldwide, actually slightly fewer this week, about 37,000 new deaths. Also slightly fewer in the US, about 5,000 less. And in Massachusetts, we're steadily getting less than 100 a week. So it's pretty good, but we may see some spikes up and down because when the numbers get smaller, then they tend to bounce a little bit more. So looking across the country here, there was a recent uptick in cases across the country here. But if you look over the daily tests there, that kind of corresponds with that uptick in testing. Testing has definitely dropped off a bit there, and as that popped up, testing cases popped up in correlation. So the drop off in testing may have had a lot to do with the fires and the hurricane, and the increase in cases might have had something to do with those too, not just increased testing. But we'll see how that shakes out in the coming week. But hospitalizations continue to decline. Deaths had a slight uptick recently, but then dropping down again, and hopefully that will continue. And as hospitalizations continue to trend down, we're actually getting close to the lowest point we've ever had since the start of the pandemic. So that is pretty exciting there. But just breaking this down a little bit by region, this is where all the cases are right now. The South and West both had upticks in their areas, which I would think would correlate to the natural disasters going on in those areas. The testing gap there then spiking back up. A little bit in the Midwest as well, and some of these also may have to do with increased testing for college reentries, where colleges are, many of them hopefully, are testing all their students, the more responsible ones at least. And that means that a lot of people who have no history of exposure, who have no symptoms, who thus otherwise there'd be no reason to test, are getting tested. So that's just throwing a lot out there in terms of testing, and then it is going to be catching a bunch more cases that we otherwise would have no reason to find. Just looking now at new cases across the country. This is where the hot spots are. Now these are raw cases, not per population. So our usual spots, California, Texas, and Florida, are still going to be the biggest, but there are still a lot of states out there that are getting more than 1,000 cases a day. But this is still lower than it was just a couple of weeks ago. All right, so let's talk about developments. A lot of things happened in the last week. First of all, of course, passing 30 million cases worldwide. That is quite a landmark there, and at the current rate, we should expect to see a similar landmark in probably mid-October, I guess, if we're getting 2 million cases a week. Also, part of what is contributing to this is a second wave is starting in Europe, particularly France and Spain, lesser extent in Italy, where there's an increase, but not much, but France and Spain are seeing case counts comparable to their initial outbreaks. So that is concerning. There's no corresponding increase in deaths yet, and it remains to be seen whether it's just we're not far along enough in these outbreaks to get to that point. Deaths do trail after cases, or it could also be that the advances we've made in treatment in the last couple of months have made it so that deaths are less likely in general. One big news on the domestic front was the CDC. Dr. Robert Redfield, director of the CDC, testified before Congress, and he shared a bunch of estimates about the progress of the vaccine. He stated that while a vaccine could be available as early as the end of the year, we shouldn't expect full distribution to regular American citizens until mid-2021. He said late Q2, early Q3 next year is when we should see really distribution, even if it is going out to essential workers before then. His estimated timeline for vaccinating enough Americans to stop the spread was about 6 to 9 months after that starts. So that is, that is living with the virus for most of 2021 there. He also said that masks are the most effective public health tool out there, possibly even more so than vaccines, and encouraged people to continue their use. One bright spot is we getting some early results on monoclonal antibodies. Those are basically, we take someone who's recovered from COVID, we find their COVID-specific antibodies, and we clone the best ones of those and inject those into people to fight the coronavirus. It has the advantage of being something that you don't have to use for severe cases, which all our current treatments, mainly remdesivir and dexamethasone, are really only for the most severe hospitalized cases. Monoclonal antibodies, you can give someone an injection the day after exposure. You can give them someone who's a moderate case and prevent them from being hospitalized. Basically, it's the equivalent of taking the massive laser gun from the last level of video game and giving it to the guy in level 1 who's got a slingshot. So we got some early results. Eli Lilly is the one working on these. They've put out some results from their trials which show early results, but they are promising. Of the control group who got a placebo, just like a saltwater injection, 6% of them ended up being hospitalized for COVID, while only 1.7, I'm gonna have that number wrong there. Less than 2% of the people who got the treatment were hospitalized. So it was a pretty small study, about 450 participants. So we'll wait to see how this shakes out in further trials with larger populations, but it is a promising result. That's about like a sort of around 75% relative risk decrease there. And then on the vaccine front, first up, Pfizer is starting to expand its phase 3 trials, looking to enroll another 14,000 people for additional participants in getting the trial vaccine. And they are looking like they may get their results the fastest because the gap between the 2 doses of the vaccine is shorter than the other projects out there. They did also get some criticism in expanding this trial because they didn't really explain why they were looking to do that, if there was some issue they're trying to correct for, if they're trying to rush through the trials by getting more participants on board so they get data faster. So there was some criticism from the public health community, and perhaps in response to that, and also the criticism that AstraZeneca got for not being more open about the adverse effect that happened in one of its participants in their vaccine that may have been linked to the vaccine or not. So in response to those things, perhaps Moderna released its whole vaccine development protocol, the guidelines for how they're processing, evaluating the data, how they're going to be checking for safety, how they're, et cetera, et cetera. So they basically released a 135-page document explaining how they're measuring effectiveness, monitoring side effects, and just gave it out to the public. And this is kind of a big thing. This is one advantage of there being so many projects out there is it seems that Moderna saw that basically there was a call for transparency and decided that it was going to be a good, make good business sense to just give everything out there. This is the free market is benefiting us for once here. And then as a response to that, earlier today, Pfizer actually also released theirs. So there are now a bunch of these vaccine protocols just out there for independent scientists to be able to evaluate. So we'll have a lot more information on how these procedures are going to make sure that have independent experts evaluating that their processes are safe and effective. So that's very good. It means we'll have better oversight over these vaccine development projects. As always, you can find the source for the data through COVID tracking, the New York Times, mass.gov. For more with MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.